Did you know that 1 out of 38 women will be diagnosed with endometrial cancer every year in the United States?
This cancer is the most common cancer of the female reproductive organs. I'm Lauren Diaferio.
And I'm Mallory Humphrey, and we're here to inform you of the possible causes, symptoms, and treatments of this cancer.
We will start by telling you causes that you should be aware of. Causes of this cancer included overexposure to estrogen, for example, if you start birth control at a young age.
Radiation therapy to a woman's pelvis,
or an abnormal overgrowth of the woman's endometrium, which is also known as uncontrollable cell growth.
In addition to these factors, this cancer can be caused by a genetic mutation. Women with the cancer carry the mutation, which is called Lynch syndrome.
Lynch syndrome is considered a missense mutation that alters the repair gene MLH1. This gene is located on the C-terminal domain of your chromosome.
The MLH1 gene is responsible for repairing mistakes when the DNA is copied prior to cell division. When the DNA goes uncorrected, the mutation can cause cell division of the uterine lining, causing it to be uncontrollable. These are some of the symptoms that show signs of endometrial cancer.
Abnormal vaginal bleeding or discharge,
excessive bleeding between periods,
pain during urination,
pelvic pain and pressure,
pain during sexual intercourse,
and blood within your urine.
The treatment of endometrial cancer depends on how high a risk it is to you.
Good candidates for surgery can have a hysterectomy or removal of the uterus, while some may be less fortunate due to the stage of their cancer.
However, radiation therapy is used to kill cancerous cells of the uterine lining for the majority of risk types.
Also, if this cancer is localized outside of the uterus, adjuvant chemotherapy is the best option for treatment, which is given as a medication 4 to 6 weeks after your surgery.
Vaginal brachytherapy is radiation therapy given through a device to the vagina. An individual can receive low or high doses of this type of radiation.
Low doses occur continuously for 2 to 3 days for 24 hours per day, while high doses use a device placed in the vagina for only a few minutes per day.
External beam radiation can also be used to give radiation outside of the body once a day, 5 days a week for 5 to 6 weeks.
The chance of recovery for an individual with endometrial cancer depends on many factors.
To begin, the stage of cancer affects recovery greatly. It depends on whether the cancer affects the endometrium only, the uterus only, or it spreads to other tissues within the body.
The prognosis also depends on what the cells look like under a microscope once removed from the body and examined.
Progesterone levels can also affect the prognosis of endometrial cancer for an individual.
After viewing this video, we believe you should know how to prevent your risk of getting this cancer.
Some ways include by getting genetic testing done to see if you are at risk because the cancer is inherited. Using birth control, which contains estrogen and other hormones at an appropriate age, and hormone therapy.
By exercising and maintaining a healthy weight can also help prevent your risk, because it decreases the amount of estrogen produced in your body's fat cells. Breastfeeding can also help, as well as if you seek treatment if you experience excessive bleeding during periods or after periods. Having a diet low in animal fats and high with fruits and vegetables can also help.
We hope that this information increases cancer awareness and helps you stay cancer-free. I'm Lauren Diaferio.
And I'm Mallory Humphrey, and we're here to discuss the possible causes, treatments, and problems. I can't even do the first line. What is it?
This gene is located on the C-terminal domain of your chromosome.
The MLH gene is... I forgot the one. Damn it. Oh my.
Causes of this cancer included overexposure to estrogen.
The MLH1 gene is responsible for repairing mistakes that the DNA...
Endometrial, which is also known as... I'm reading the wrong line.
If you're not already aware of the symptoms of this cancer, we will go through some of them right now. After viewing this video, we believe you should be equipped with ways to prevent the